This video focuses on nursing assessment of the peripheral vascular and lymphatic systems. Viewing this topic will enhance your ability to identify common and concerning symptoms related to the peripheral vascular and lymphatic systems, employ appropriate techniques of interviewing and therapeutic communication as you gather subjective data about these body systems, perform a physical assessment of these systems, understand normal findings as you assess, and document and communicate findings from this regional assessment clearly and accurately. The peripheral vascular system is a key component of the body's complex cardiovascular system. It is responsible for circulating oxygen and nutrients via the bloodstream throughout the body via a network consisting of the arterial and venous systems. The venous system collects deoxygenated blood and returns it to the heart. The arterial system delivers oxygenated blood from the heart to the rest of the body. The lymphatic system supports the vascular system. It consists of lymph nodes, which are essentially filters, and lymphatic capillaries and vessels. The purpose of the lymphatic system is to drain excess lymph fluid from bodily tissues and return it to the venous system. During this process, the lymphatic system assists the immune system in fighting infection and maintains fluid and protein balance.
Disorders of the peripheral vascular and lymphatic systems can have serious implications for a client's health. Problems often develop gradually, and severe symptoms sometimes don't become evident until extensive damage has occurred. Therefore, as nurses, we must be able to accurately assess the symptoms and risk factors for these systems. When assessing the peripheral vascular and lymphatic systems, you will assess family and personal histories of vascular disease. Ask questions about lifestyle, and be alert to a variety of common and concerning problems.
Common and concerning problems resulting from impairments in the peripheral vascular and lymphatic systems include pain, numbness or tingling, cramping, skin changes, edema, and decreased functional ability.
It is important to ask your client about each of these concerns. Whenever the client indicates a positive response, use effective communication techniques to gather more detailed information. For example, Mrs. Chenoweth is a 55-year-old woman visiting the healthcare facility today as a result of feeling pain in her legs. She has a history of varicose veins, which she reports appeared to be worsening. Prior to the interview, make sure the room is comfortably warm, as cool temperatures may affect a peripheral vascular examination. Start your interview by establishing rapport. Introduce yourself to the client. Explain why you are conducting the interview and how your session will proceed from health history taking through the physical examination. By obtaining a history of present illness that explores the features or variables of the specific reason for seeking care and its related symptoms, you will better understand the client's perspective and be able to provide a detailed record of her experience as care progresses.
What brings you in today, Mrs. Chenoweth?
My varicose veins are getting worse, and now I'm getting pain in my legs.
You say your varicose veins are getting worse. Can you describe what you mean by worse?
I have more varicose veins, and now they're starting to stick out more.
Can you describe your pain for me?
It's throbbing and dull.
Is it continuous or occasional?
It doesn't happen every day. It's mainly after I've been at work all day, and then the pain doesn't go away until I rest with my feet up.
Okay. Have you noticed any other symptoms? Like swelling, redness, cramps?
Oh yeah, I do have a little swelling if I'm on my feet all day. In fact, I can show you there's like a ridge here.
I see. When do you start to feel the throbbing?
Well, the pain happens at work mostly because that's the only time I'm standing so long. I got a new job. I'm a grocery store checkout, and before that I had a sit-down job making phone calls. I didn't have any pain, but it was boring. And then before that, I was in an office dispatching trucks, but I got laid off, so,
Well, getting back to your current position, how long have you had this job?
about 2 months.
About 2 months. And when did you first start feeling this pain?
About after 2 or 3 weeks.
Okay. When you feel your leg pain, and it starts after about an hour or two of standing, how long does it typically last?
The whole time I'm standing.
Okay. On a scale of 0 to 10, with 0 being no pain and 10 being the worst possible pain, how would you rank your leg pain?
When it first starts, I would say it's a 2 or 3, but by the end of the day, I would say it's a 6 or 7.
Okay. Can you show me where it hurts?
Oh, my entire leg from here to here. But the worst pain is right here at the top of my calf.
And is it just the one leg or both?
Both legs.
Okay. And you said that resting with your feet up helps. Is there anything else that makes it better?
Between customers, I can lean up against the counter. Takes the weight off and helps a little.
Have you ever tried wearing compression hose while you're at work?
No? Do you think it would help?
Quite possibly. Compression hose provides support to the vein, and they may help decrease some of the pain and swelling that you're experiencing.
Continue to explore aspects of the client's health history, symptoms, and life circumstances to ensure a comprehensive reporting of data. Also, review all pertinent health promotion
What
measures.
support hose look like? Is there a family history of hypertension, diabetes, cardiovascular problems, or elevated cholesterol?
Not that I know of.
Is there a family history of varicose veins?
Yeah, my mom had them bad.
Varicose veins can be hereditary. They can also develop as a result of pregnancy. I can see from your chart that you have 2 children.
Yeah, I have a son that's 22 and a daughter that's 18.
Has your leg pain affected your daily activities?
I'm afraid I'm going to lose my job. They don't even have any sit-down positions for me. When I get home, I can't even stand long enough to make dinner.
I understand. Pain is difficult to deal with. And when it affects your job and your home life, that certainly aggravates the situation. We're going to move to the exam table now, but when we're done, we'll discuss some things that might alleviate your pain a bit.
After completing your subjective data collection, continue the documentation of your findings in the client's health record. Be sure to report both positive and negative findings clearly and accurately, and provide details about any positive findings to give as clear a picture as possible about the client's current health concerns. After interviewing to obtain subjective data, conduct your physical examination to obtain objective data. After performing hand hygiene, warm your hands to aid client comfort.
For learning purposes, this video will demonstrate a comprehensive physical examination of the peripheral vascular and lymphatic systems. In actual practice, nurses may use only a subset of these techniques, depending on the client's chief concern, the healthcare setting, or other parameters. The nurse may also find it useful to conduct portions of the physical assessment at the same time as the interview, rather than conducting these tasks separately. The following tools and supplies are generally used when examining the peripheral vascular and lymphatic systems: examination gown and drape, measuring tape, gauze or tissue, waterproof marking pen, and sphygmomanometer. In cases where pulses are not palpable, you should also prepare a Doppler ultrasound device and ultrasonic conductivity gel.
Your physical assessment will generally involve inspection, palpation, and testing, with auscultation only when arterial occlusion is suspected. For inspection, expose only the area of the region that you will be examining. When assessing these body systems, visualization of the client's arms and legs is required, including the legs up to the groin area. Always gather the gown and arrange draping carefully so that the client feels least exposed, and explain your rationale for exposure to ease the client's anxiety. Begin by inspecting the client's arms. Observe arm size and venous pattern, and look for edema. Note also the coloration of the client's hands and arms.
Arms bilaterally symmetric with minimal variation in size and shape. No prominent venous patterning or edema. Arms and hands show no erythema, rashes, or lesions.
Next, palpate the client's hands, fingers, and arms, noting temperature.
That looks really good.
Skin warm bilaterally from fingertips to upper arms.
Next, perform the blanch test to assess capillary refill. Compress the nail bed until it blanches. Then release the pressure and note the time it takes for color to return. Color should return in less than 3 seconds, indicating good peripheral perfusion and cardiac output. Repeat the test on the client's toenails.
Capillary refill on fingernails and toenails, less than 3 seconds. Okay, now I'm going to check the pulses in your wrist, so just turn your hands over a little bit. Good.
Palpate the radial pulse in both wrists, noting strength and elasticity.
Radial pulses 3+ bilaterally with resilient arterial walls.
If you suspect arterial insufficiency, you may also palpate the brachial pulses.
Brachial pulses 2+ bilaterally.
Next, palpate the epitrochlear lymph nodes. Normally, these nodes are not palpable. However, if you do detect them, note their size, tenderness, and consistency.
Epitrochlear nodes non-palpable.
Next, inspect the client's legs. Prepare by placing a pillow beneath the client's head. Then help her into the supine position with head elevated to 30 degrees. Inspect each leg from the groin to the toes, observing skin color and distribution of hair, and looking for lesions, ulcers, and edema. Because female clients frequently shave their legs, it may be useful to ask about changes in hair growth since distribution in hair would not be observable in these clients.
Have you noticed any change in the distribution of the hair on your legs lately?
No, I haven't.
Okay. Pigmentation even. Hair on legs has been shaved. Coverage on legs and dorsal surface of toes appears evenly distributed.
Next, palpate bilaterally to assess temperature of the legs and feet.
Legs, feet, and toes are equally warm bilaterally.
Next, palpate the superficial inguinal lymph nodes on each thigh. Normally, these nodes are not palpable. Note their size, mobility, and tenderness.
Superficial inguinal nodes non-palpable.
Next, palpate the femoral pulses.
Go ahead and bend your knee for me a little bit.
Press slowly but deeply using both hands if necessary. Then slowly release the pressure until you feel the femoral pulse. Repeat on the opposite leg and compare amplitude.
Femoral pulses 2+ and equal bilaterally.
Next, palpate the popliteal pulses.
Can you flex your knee for me a little bit? Good.
The popliteal pulse is often difficult or even impossible to detect even when circulation is normal. If you can't detect the pulse with the client supine, try again with the client lying prone. Repeat on the opposite leg.
Popliteal pulses detected in prone position, 2+ and equal bilaterally.
Next, palpate the dorsalis pedis pulses. It is useful to assess both pulses simultaneously to aid in making comparisons bilaterally.
Dorsalis pedis pulses, 2+ bilaterally.
Caution: the dorsalis pedis pulse is absent congenitally in 5 to 10% of clients. If the pulse is not palpable and there is reason to suspect pathology, a Doppler ultrasound should be ordered.
Next, palpate the posterior tibial pulses. Again, it is useful to assess both pulses simultaneously to aid in making comparisons bilaterally. Then palpate for edema.
Posterior tibial pulses 2+ bilaterally. Trace edema evident on both ankles.
Varicose veins tend to be less visible when the client is supine or sitting. So next, assist the client to a standing position and inspect for varicosities and thrombophlebitis. To fully assess for a suspected phlebitis, palpate for tenderness.
Does this hurt?
No.
How about over here?
No, not really.
Several clusters of varicosities noted on posterior surface of the right leg just above and below the popliteal space. Varicosities non-tender.
After completing your objective data collection, document both positive and negative findings, using the correct phrasing of the documentation of normal findings as demonstrated during the assessment.
You definitely do have some varicose veins over your
Mrs.
legs.
Chenoweth's varicosities have increased since her last visit. To help prevent a worsening of her symptoms and to promote enhanced circulation to her extremities, the nurse reviews ongoing health promotion measures and suggests additional measures. You need not wait until after your assessment to address these issues. Instead, weave client education throughout your interaction with the client whenever appropriate. The nurse concludes today's session by ensuring client understanding about the importance of circulatory well-being, the importance of a daily walking regimen and other regular exercise along with weight control, and strategies to reduce pain and prevent progression of her condition.
Okay, so this is for you to take home. And then we have the pamphlets that I showed you earlier. This has a lot of really good information about varicose veins and how to help manage them, posture and clothing that you can wear. So you can take these home and read them at your leisure.
The nurse also educates her client about how to spot symptoms that suggest her problem is worsening. These symptoms include an increase in the size, extent, and painfulness of existing varicose veins, and the formation of new ones. The nurse encourages Mrs. Chenoweth to follow up with regular visits to her primary care provider to assure monitoring of vital signs and cholesterol and triglyceride levels, to aid identification of diagnoses, and to initiate a plan of care.